non-cardiogenic pulmonary edema. Okay. So in our center, we basically I have yet to do a postmortem on patient who died of ARDS. Okay, especially acute respiratory distress syndrome. Okay, especially now with the COVID-19, if patient is confirmed C19 positive, then definitely we do not proceed with any postmortem. Okay, but there's an interesting paper that was published in Lancet, some big journal of the postmortem finding in COVID-19 patient. Okay, I'll share that article a bit later in the e-learning. So we've learned about ARDS as a cause of non-cardiogenic cause of pulmonary edema. So compared to the lung that we saw just now, this lung appears a bit stiff. Okay. And there's a lot. The sponginess is there in some area, but most of the lung parenchyma is very stiff. Okay, and under higher power, so there is a diffuse consolidation mainly on the left side here. You can see the difference of the color. So this is a normal lung parenchyma. Look at the alveolar space, how it is very small. These are the terminal bronchi, or this is a blood vessel. Okay, but this area here, it looks a bit solid compared to the one here. You still can see some holes here, but you see this area is filled up with the exudate. Okay, so under when we take the sample from that area, so this is what we observe under the microscope. So you see these are all are the alveoli. It looks a bit busy. Okay, a lot of inflammatory cells here. All these blue cells are inflammatory cells. Okay, and apparently the wall of the alveoli looks a bit haphazard, and there's a thickening here. Okay. Okay. This is thickening. This is hyaline membrane. Okay, hyaline deposit of the. This is what we call diffuse alveolar disease. Okay, so there's hyaline membrane here. So it shows that this hyaline membrane is actually due to a lot of inflammation and damage of the pneumocytes. So it fills up the wall. Okay, and this is another picture of it. This is a hyaline membrane. Okay, and this area here, I assume this is the pneumocyte that has been disrupted. And this is the arrows should show the hyaline membranes, and the background there's a lot of inflammatory cells. There's a video that you can watch. I will share the the link later.